Hello, I'm Dr. Jack Lynn, here in Laguna Beach, California. I own and operate Defiance Fitness, which is a private fitness studio here next to the beach. One of the things that I do is work with the more mature person who may be experiencing balance issues, instability, fear of walking in crowds, etc., up and down steps. Because as we all age, in most cases our bigger muscles, leg muscles, back muscles, etc. get weaker. And we've become more unstable, and even the muscles in our feet become somewhat weaker. So I put together a series of examples of types of therapy or exercises that I use with the more mature clients that come in here to the studio. And I thought I would share those with you because you may be in need of some of these types of training therapies, or you may have a loved one, a parent, an aunt, or an uncle that may benefit from some very private training directed especially toward their issues of balance and strength as they age. With my background in surgery, orthopedics, and then pain and rehab medicine, I have a little different qualifications than most who are trying to help the more mature person attain a better life, a life of more independence, a life of where they feel comfortable in functioning as they used to. So I will run through a few short videos for you describing some of the techniques, and you'll be able to see some of the things that I've found to be very helpful for these individuals. Now, this is another exercise. This is a T-bar exercise for the back, the arms, the shoulders, and also the legs. I use different types of exercises, of course, to develop leg strength, back strength, flexibility. In this particular exercise, it's very safe because he's holding on to a handle. He's using a bar that's abutted against another one of my devices here. And he's using his quads primarily, but also his upper back and his traps, and feels very comfortable in doing this. So one of the improvements in his overall stability is the improvement in strength. Again, a strength exercise, but monitored, and one where he feels very secure in doing it. Now, in this short segment, you'll see here, this is developing strength and balance with this particular person. And he's developing now strength in one leg at a time. Well, actually both legs, but one leg you'll see is up on a ball, an unstable ball. He's holding on to the bar because that's what he needs for stability. And then in addition to that, he's gaining strength in his low back, his thighs, his glutes, and stability with his arms, feeling totally comfortable and totally safe. Again, you'll notice that in this segment that I'm always within arm's length. Many times I have my hands on my particular client that I'm working with because it's very important that they feel safe and they feel stable. Because if that's not happening, then it's not a good experience for them. Now, in this short segment, you're going to see a stretch that I use with my clients, and you'll notice sometimes I have to help a little bit more and position a person in a little different way so they're able to accomplish the stretch. But now you'll see that the inner left thigh is being stretched. There's support on the knees with yoga blocks. He's holding on to the bench in front of him. And it's so important as we all age to maintain our flexibility, to maintain our ability to move around, to twist, to turn, to reach. As we lose that ability, it's much more difficult to walk and get in and out of a car and even up and down out of a chair, in a bed and out of a bed. So this is one of the stretches that I utilize, very safe, and I see improvement with my clients almost weekly when they do these stretches.